Welcome to my episode interview with prosthetic urology leaders across the world. It is my objective to get you to talk to, understand, and meet the best in the penile implant business across the world. Previously, we have connected you to surgeons like Mr. Dr. Hamdan from Jordan and other doctors from across the world who have discussed penile implants and how they change men's life. And today we have with us Dr. Sebastian Beley, the head urologist at the American Hospital in Paris, who, apart from being a world leader in penile implants, also is a teacher, a much loved teacher who has trained students in the art of penile implants and erectile dysfunction across the world. He is in great demand across the Middle East and at European centers, where under his tutelage, he is creating the next leaders in the penile implant world. I am Dr. Vijayant Govinda Gupta, New Delhi, India, a urologist with special interest in penile implants and currently who does the maximum number of penile implants for patients across the world who live in India or who travel to India for their prosthesis. In today's interview, we will ask Dr. Beley some interesting questions about penile prosthesis. These questions are for patients. These questions are for the patients to understand the penile implants better. And so stay tuned for an interesting discussion, and this discussion may help you make up your mind about getting a penile prosthesis to cure your erectile dysfunction. So let's start. The $1,000,000 question. A lot of patients coming for a penile implant also think or want an improvement in their premature ejaculation. Do you think penile implant helps in that? What kind of complications you tell the patient in your practice before he goes ahead for a prosthesis?
Yes.
What is the societal acceptability of the penile prosthesis in France and why training is very important? So the $1,000,000 question. A lot of patients coming for a penile implant also think or want an improvement in their premature ejaculation. Do you think penile implant helps in that
Yes.
or in the
Yes.
situation?
Yes, I definitely do. I just had a patient asking me for that specific problem the day before yesterday, and this is what I told him. I told him, first thing, one of the reason why you have premature ejaculation is because your erection is weak. That's one of the problem that gives premature ejaculation. When your erection is weak, your brain wants to make sure you are going to ejaculate before the end of the sexual intercourse. This is how we were built as animals. We are meant to have sexual intercourse to reproduce. So that's very, very difficult to fight against premature ejaculation when your erections are weak. So first thing, we are going to fix that. And second thing, when you have a penile implant, even though you get the first ejaculation quite quickly, you'll be able to stay rigid and to go on and to move on for a second intercourse without being stressed. So that's the second thing. And the third thing, of course, what we just talked about, which is self-confidence. You know that if you have sexual intercourse, even if you may have the first ejaculation very quick, you are going to be able to make your wife satisfied. So that's preventing the feeling that you are not giving your wife a good moment, and which is making some of the guys who have premature ejaculation lose their appetite for sexual intercourse because it ends up like a bad moment. So penile implant is one of the solutions that we have to fix premature ejaculation.
Okay, so every big implanter, every guy who does like cases like you do, so many cases, they have some patients whose life was transformed. Can you share such a story with us about some patient, remember, who changed his life after the penile implant?
Yes, I remember a patient that I've seen last week. He was treated for prosthetic cancer. He got surgery for that, and before his surgery, he was a quite active man, sexually speaking. And for quite a long period of time, a few months, he decided he would not go to penile implant, even though the pills were not working, and even though the shots, he was doing self shots, these ones were very painful. So he changed from sexual activity, which was fulfilling, to lack of natural erection and painful situation when he was giving him the shots. So he was very sad, and he was absolutely not enjoying the recovery from his cancer. He had totally forgotten that, and he was now focused on how before and after he was treated for his cancer, he just lost to him everything. So even though he was not going for penile implants, he thought it was not a solution for him. He thought this solution was a solution for older men. I explained to him, the device will not be seen. This is very discreet. It's hidden. It's inside the penis. You don't have to tell your girlfriends, because he was not married already. You'll be able to be confident in your in your erections again. So I explained to him what we just talked about, you and me, the last minutes, and finally he did the surgery. And I will always remembering him when he got back to sexual activity, and he told me, I should have done that much before. I should have done that earlier. And we know as prosthetic surgeons, when we get patients who say thank you, how much this is valuable to us, how much this is making our day. This is one of the reasons I decided to do this surgery, actually, because most of the patient, they don't remember the name of the surgeon who did the kidney transplant or who did the surgery for the cancer. But the patient, they always remember the name of the doctor who treated them for erectile dysfunction, because that's a big change in their life to a better one.
Every time he has an orgasm, he's going to remember Dr. Beley.
Yes.
So it's always not all good. So sometimes when we talk about penile prosthesis, the patients think that it's a bed of roses and we're going to get the prosthesis and we're just going to be okay. So
yeah.
How do you tackle? So what kind of a recovery process or what kind of complications should the patient be careful about? Or you tell the patient in your practice before he goes ahead for a prosthesis?
Yes, that's a very important one, because once they decided they wanted to do the surgery, then they need to accept all the to-do list that you are going to give them. Because if we know that if we want to achieve a good result, they will need to follow some rules. First one is to quit smoking. I tell them no smoking at least 2 weeks before, and no smoking the month after surgery. Because if they keep smoking, the healing of the wound will be more difficult to achieve, could be even impossible to achieve in the big smokers situation, and they might also get infection. The risk of infection is 3 times bigger when you are still smoking at time of surgery. Remember, hand surgeons, they don't do fingers reimplantation. If you cut off your finger and you're a smoker, the finger that you cut off is going to the garbage. They are not going to try to fix it because your arteries are too small. So the same goes for us. We need a good blood inflow to achieve healing. So first rule, stop smoking. Second rule is I tell them, balance your diabetes. If your glycated hemoglobin is too high, you're going to experience difficulties to heal, and you will get a higher risk of infection. The third rule is I tell them, take the painkillers. Even though you don't have pain, take the painkillers for the first 2 weeks. Even though you don't have pain for the first days post-op, which is most of the case, the usual situation. The pain can come up when they go back home and they start doing things, working a little, standing up. So the first 2 weeks can be challenging regarding pain if you don't take the medication. Then I tell them to wear tight underwear for the first 2 or 3 weeks, even jock strap if they can. But if they cannot, at least tight underwear to give them a good scrotal support to lower the pain that they can get from that area post-op. I tell them to take antibiotics for the first days, usually 5 to 7 days. And I tell them to do whatever it takes to keep their skin clean. I'm using betadine gel on the suture line once a day for the first 2 weeks. And also I tell them, if you notice anything abnormal, like pain that the medication will not be able to treat, or any abnormal thing at the level of the wound, come back to me. Don't take appointment. Come back directly to my office. So I want to see what's going on.
That's very good advice. I think that's something we tell our patients too, but I think you summarized it beautifully. So we'll not take more time, and I think we covered most topics. Now we just want to know what is the societal, exception or acceptability of the penile prosthesis in France. Like for in India, it's way down. So people want to keep trying medication, and then we have Ayurvedic, and we have a lot of pseudo-scientific treatments that they keep doing, and then when things go really bad and when nothing works, then they come for the surgery. Is it similar in France, or do doctors and physicians refer patients earlier?
No, it's the same in France. Actually, it comes from a lack of information, about erection itself amongst most practitioners. So aside from that, there is a lack of knowledge amongst the doctors about solution for erectile dysfunction. They think that if pills are not working, then you cannot do anything else. Then you have some doctors who know that penile implant exists, but they think it's not the right situation. It's not the right solution. So they will mislead their patient, telling them, no, you shouldn't do that. It's not working. It's dangerous. You will get infection. I tell my patient that the risk of infection is lower than the risk of infection when you get a hip replacement surgery or a knee replacement surgery. Do you hear any general practitioner telling patient you shouldn't get any hip replacement? No. So that it comes also from the fact that we are talking about sexuality. So it makes some general practitioner, some GPs uncomfortable with the thing, talking about sexuality with the patient in the also if the wife is there in the clinic. So they say they will get very fast over the problem, say, oh, take the pill, it's okay, the surgery is not a good solution. They don't listen to the patient. They don't take care of this problem very seriously. But we see these last years now in France and in Europe that the numbers are growing slowly because now it's more accepted. The reason is now the penile implants are safer. Like the new brand like Vijayant, they brought to the market very safe devices, and also we have high volume centers now that they are easy to spot in each country, and we know that from these centers we get the good results. So even though still the population is shy regarding penile implants, the numbers are growing because people see that it's the right solution. And one last thing that I wanted to say that is penile implants can seem a strange thing when you don't have erectile dysfunction. So when another doctor or another guy will listen to you as a patient when you say I might get a penile implant, they will tell you, "Oh, that's strange. Why do you want to do that? It's not natural." And they will give you a lot of argument. But the thing is, they don't have erectile dysfunction themselves. They don't know what those patients are going through. They are going through hell. And you can have whatever you wanted in life, money, kids, a good job. If this thing is missing, every day, even the day you will not try to have sex, this will be in your mind and you will feel that something is missing in your life. So when you get a penile implant, when those patients, finally they get the penile implants and they get their problem fixed, they say, I should have done that way before. And they get the improvement, not only in their sexual life, but in their quality of life when you think about it globally. It's a major improvement in their life.
So Dr. Beley, apart from a large volume penile implanter, you are also a teacher and you have trained and taught so many students of so many years in this art of penile implants. And definitely a lot of budding implanters and young urologists will be looking at this interview. Could you give them a message of why they should try to become better prosthetic surgeons? And if they are in the process, what they can do to improve their skills and why training is very important?
Yes, it's the training is very important because the prosthetic surgery is a work that is only beginning at time of surgery. Let's say when you remove a kidney for cancer or you remove a stone, the job is done at the end of the surgery when you leave the operating room. When you put a penile implants, it's only the beginning, and there is very much to do in learning how to avoid complication in the OR, because what you are not going to fix in the OR, you will not be able to fix after. So it's important to learn from your colleagues who already are doing this surgery, to train yourself for the tips and tricks and not to build your experience by yourself, because it takes years and years. It took me 20 years to achieve the good amount of experience to avoid those problems. Still, you will get difficult patients. Still, you will get some failures, but you will move on. You will be able to take care of those patients.
Okay. So thank you, Dr. Beley, for giving your Sunday today. And I'm sorry to disturb you on your Sunday.
No,
but I'm
it
sure
was my
that
pleasure.
This interview is going to really help men looking at getting penile implants in France and also across the world. Thank you for joining us today.
We hope. Please, very happy to meet you again. I hope we will be able to do another one after a few months, and I will make sure that I get your address also on the link, so I can share it with my patients spending their time between our two countries, so they can come to you. And once again, congratulations for the great work you're doing.
Thank you so much.
Hope
and
to
we are
meet
looking forward for you to come to India.
Actually, I want to
India
come.
And yes, so we will
make it happen.
Yes,
I'll
for
be
you
more.
to come to India.
I will be more than happy to meet you and see your setup, how you are working, and that would be a great pleasure.
But I think my patients will be very happy to see you. So we are going to, because we like them to see big surgeons, because it gives them confidence that there are guys who can
we
fix
know
them.
each other. Yes, exactly.
Thank you so much. Have a great day.
You too. Keep up the good work. Goodbye.
Thank you. Bye.
Hey kid, don't ever let them get inside your head. They'll tell you what to do in life instead of everything you know that you could get. Don't let them guide your life towards regret. I'll fight for what I love with every breath. My past is filled with things I won't forget. I use them all to push me to my best.